So I almost gave up working out because of my lower back injury. My doctors and physical therapists told me to lay low, take some rest, and not lift until the pain goes away. Every time the pain went away and I went and pushed harder, the pain would come back. That's when I realized it's all a bunch of bullshit. So I used what I learned from my physical therapy degree and went out and learned from industry leaders who work with pro athletes. And using everything I learned, I made my own approach that helped me go from 2 disc herniations, a left burning leg, and a fragile spine to be able to deadlift 500 pounds and run 2 half marathons. And today I'm going to teach you how to do the same in 3 easy steps. Before we start, we want to make sure there are no red flag symptoms. You can see the list here. If you don't have any of these symptoms, then you don't even need to get an MRI, as it would be a waste of time and money. Now, moving on to our first step, we want to find out your spine's movement bias. Bend forward and try to touch your toes. If your spine feels okay or even better, that means your spine has a flexion bias right now. Now lean back like you're stretching after a long day. If that makes you feel better, then your spine has an extension bias right now. And if neither feels good, that's also fine. That just means your spine doesn't have a clear preference right now and you would need a more detailed assessment. Now once we've determined the bias, we go into our gentle range of motion exercises for the first 7 to 14 days. This will include supine breathing, pelvic tilts, Caesar slides, knee rolls, and 90-90 transitions. Also exercises that will either work on the flexion bias for bending forward or the extension bias for extending back. And you slowly want to use them to desensitize from the pain. Next, we'll work on building capacity in 3 major muscle groups that will help stabilize your lower back and pelvis. The first one is the hamstring. If your hamstrings are tight all the time, that means they are extremely weak to stabilize your lower back and your pelvis. They are one of the major muscle groups that help to keep your pelvis stabilized and help extend the hip. And if they're not doing their job, guess who picks up the slack? It's your lower back. You're going to use these 4 progressions to start strengthening your hamstring muscles. You have to make sure you can complete 15 repetitions without breaking form before moving on to the next level. Remember, it's very important to feel the target muscle, which is your hamstring and not your lower back. Second, we have the adductors, which are the most undertrained muscles for anyone with lower back pain. They help you internally rotate and shift into that hip so you can use more of your glute muscle. And if you cannot do that, then one side of your hip and lower back starts to take too much stress and things start to break down. So you will use these 4 levels and make sure that you're doing 15 repetitions before moving on to the next level. And for the hold, it needs to be at least 30 seconds without breaking your form. Third is your glute muscle, which most people train with the bullshit clamshell exercise that doesn't do much. Your glute needs to be able to move your body weight and not some light resistance band. If you're unable to push your body weight using your glutes, then your lower back starts to compensate and gets really painful. So you will use these 4 levels to strengthen your glute muscles. For the hold, you need to make sure that you can do 30 seconds without breaking your form and 15 repetitions for level 2 and 3. Now comes the third step, where you're going to do deadlift and squats, because if you cannot do them, you've been scammed and your rehab sucked. We will pick one of these variations of the squats that you'll find easy and a variation from here for the deadlifts that doesn't cause any pain. You want to start with 3 sets of 10 and make sure you're only feeling the target muscles and no lower back pain. Now if you're serious about actually healing your lower back pain and getting back to an active lifestyle without feeling weak or fragile, then I'm a physical therapist who predominantly works with people with lower back pain for many years now. I've helped hundreds of people like you get back to a point where they don't even have to worry about their lower back pain ever again while doing their intense workouts. So if you want to learn more about my one-on-one program where I get you on a plan tailored around your body and your goals that is very easy to follow, you make improvements every week, and I keep you accountable for the whole 6-month process, then comment lower back below and I'll personally reach out to you. Also, stay tuned for my more free trainings coming soon.